is my persuasive speech. For this topic, I chose the topic of why you should not get the COVID vaccine and why it should not be required for anyone to get it. First, there's not enough research on this vaccination. Second, no one knows the long-term effects because it hasn't been out long enough. Third, by government regulations, it has become enforced when the United States of America freedom has been fought for so that we can have choices and should be able to make decisions upon what's best for you. COVID-19 vaccine mandates have become a contested issue, and as the coronavirus cases and hospitalizations rebound nationwide, driven by the highly contagious Delta variant and unswerving vaccine hesitancy. New York will soon be the first major U.S. city to require proof of vaccination to enter restaurants, gyms, and other indoor public spaces. Dr. Makery, a professor at Johns Hopkins University School of Medicine and editor-in-chief of MedPage Today, argues that mandating vaccines for every living walking American is of now not well supported by science. Makery, author of The Price We Pay, What Broke American Healthcare and How to Fix It, has concerns about the 2-dose vaccine regimen for young people. Requiring the vaccine in people who are already immune with natural immunity has no scientific support. While vaccinating those people may be beneficial, and it's a reasonable hypothesis that vaccination may bolster the longevity of their immunity, to argue that they must get vaccinated has zero clinical outcome data to back it. As a matter of fact, we have data to the contrary. A Cleveland Clinic study has found that vaccinating people with natural immunity did not add their level of protection. So instead of talking about the vaccinated and the unvaccinated, we should be talking about the immune and non-immune. Immunity is something people can test for with a simple antibody test. The risk of hospitalization from the COVID-19 in kids ages 5 to 17 is 0.3 per million for the week ending July of 2021. According to the Center for Disease Control and Prevention, we also know that the risk of hospitalization after the second vaccine dose due to myocarditis or inflammation of the heart muscle is about 50 per million in that same age group. The one who founded and started Microsoft, co-founder Gates, said in an interview, "We will have some digital certificates that could ultimately show who's been tested and who's been vaccinated. This could mean that the vaccine has a microchip in it, and this chip could track everything you do. Vaccines will be licensed only after they have been shown to be safe and effective in general population groups. This leaves many unknowns, whether one vaccine is more effective than the other, how vaccines will work in people who are at the greatest risk of severe illness, whether vaccines will prevent transmission or severe disease, how long immunity lasts. Also, which groups might resist or reject immunization because of ideology, mistrust, or misinformation." The motivations are many and varied. Some say that as a healthy physical individuals, they feel they don't need to be vaccinated against what they can see as a majority case is a relatively mild case. A large number feel that as COVID-19 vaccines have been used or authorized for emergency use only, there is not enough research in their long-term safety and efficiency. And the fact that a small number of vaccinated people can still get COVID-19 even if they are unlikely to suffer from serious symptoms or to be hospitalized is enough to make some question the value of getting the jab. A number of people have decided not to get the COVID-19 vaccine because they have held the disease and believe their natural immunity is as strong as the vaccine to ward off serious illness from COVID-19. A smaller number of citizens expressed fears about how COVID-19 vaccines might cause damage during pregnancy, to fertility, and to the children. Same effects in the vaccine, and some believe that the vaccines are simply a way for the pharmaceutical industry to make more money from a compliant public issue. Some people suggest that other treatments for COVID, such as patient intervention and hydroxychloroquine weren't encouraged for use because vaccines were deemed to be the solution. Thank you.